Hello again. Welcome to another episode of Asanya in Therapy. I'm your host, Tlaka. Today, my guest, Mrs. Karabo Zwane, is the founder of Hana. You Are Not Alone, an NPO. She and her husband, Pastor Jerry, struggled to conceive for 7 years. They experienced a range of challenges during their fertility journey, such as an abnormal morphology, four miscarriages, and an ectopic pregnancy, and two failed attempts of artificial insemination. Depression, shame, and loss of hope took the best out of them. They have devoted themselves to helping couples rise above the shame of infertility by starting Hana, You Are Not Alone, as an NPO. Hana seeks to provide support to those struggling with infertility, to bring awareness about a disease that has left many destitute and stigmatized. Mrs. Zwane, thank you very much for joining me to discuss a very important topic.
Thank you so much for having me.
Yes, I mean it's quite a sensitive topic that many people struggle with, and there's this quote we normally say in psychology circles, right? The wounded healer heals best. So you went through this journey as a couple, and now I mean you got to a point where you work through your own challenges, and now you started an MPO to assist people. Maybe take us a little bit back. Now you are at that stage where you are helping other people, but where did it all begin exactly?
Yeah, it first began when we had fertility challenges. We dreamt of having a family, like I think every couple at some point you dream of having children. So we got married fairly young. I was 20, he was 26. But we decided that we're going to take 4 years while both of us were completing our studies. So the conceiving part in the first few years of our marriage was not something that we were working on. So we were deliberately on contraceptives because we wanted to wait. So the plan was by year number 4, we should be pregnant. And that's when we started now stopping using contraceptives, and nothing was happening. And during that time, I found it very difficult in the community to find someone to talk to about the challenges that I'm having. The best thing was, take cinnamon and honey every day. It will help you. But as to what infertility is it possible that I might have fertility challenges? No one in my family has had fertility challenges. We've got a huge family. Even my grandparents didn't have fertility issues. So information was scarce for us. And my husband already had a son from a previous relationship. So obviously now all the focus is on me because I'm the one now that doesn't have the evidence that I'm fertile. So that is how Hana, You Are Not Alone was birthed. It was birthed out of the lack of information that we had experienced when we were trying, and we just want to give couples that space where they can ask questions, talk to professionals about their difficulties, and in most cases, people do find help.
Yeah. As you were just telling your story there, I was reminded by, I think Michelle Obama in her book, Becoming, has a portion where she talks about that, right? But what struck me is when she said that, when she talks about, losing a baby, struggling. So you guys were pregnant, you were struggling, and then, and she said that she wishes that this was shared, there was information. So when you said, you couldn't find anywhere to go, and it sounds as if it's something people struggled with long ago and even now, but you guys decided to do something about it.
Mm-hmm. Absolutely. So, repeating on just what you said now, Michelle says miscarriages happen too often, that people don't talk about them. So, let's say 1 in every 4 pregnancies will end up in a miscarriage. But it's still such a stigma to talk about miscarriages in our community, especially as Africans, because then it's seen as either you are bewitched, you shouldn't have had a baby shower, and all of that. And then we don't look at the medical part of what contributed to the miscarriage. Is it something that could it have been hypertension? Could it have been an autoimmune disease that happened? There's always a reason why certain things happen. And I think we don't get to a point where we go into details to find out what is it that could have been the problem. So we are afraid to talk to our doctors. Language is also a barrier where you go to a doctor and you can't seem to explain yourself. What is it that you are feeling? I always make an example of when someone says, you know, as Africans, we understand.
What is that in English? Yeah.
But when you go to a doctor that does not speak your language, what then do you say? So in most cases, I think patients are going through that as well, where they are unable to express their fertility challenges. But the main thing is, with our story, is that the patient was my husband. So at some point, we went to a fertility specialist, and they found that his sperm is not healthy enough to impregnate a woman. And this is a man that has had a child before. So this means that from the delivery of the conception of his first son, to us trying, there were lifestyle changes that he did that affected the quality of his sperm. So we had a male factor fertility challenge in our marriage. And guess what? It's difficult as umakoti wa Mazulu to say, hey, mtane nuye that is having a change, you always want to protect the ego of the man. And it was so difficult because I was the one that was facing the challenges, the questions. How can uzoba nomntwana nini? At some point, one of the elders in the family suggested that he take a second wife, because lona akakhoni, like in front of me. You should consider taking a second wife. And these are things that women go through. They're questions even in religious organizations like the church, where you are expecting to encouragement. And these are questions statements that people say out of ignorance, but they really get to you, as someone that struggled with infertility. I'd wake up at 3 o'clock in the morning, early hours of the morning, and then the question is ringing now in my head, and then I'm thinking, this is what I should have said. So it's lack of knowledge. Another difficult one is during Mother's Day. Mother's Day are the most difficult times for people that are trying or that have lost pregnancies. Because for me, it was yet another reminder that, okay, here's another year where I'm not included in the mother, gang. And all of us want to be a part. I think there's a genuine need for us as human beings to belong. And when you don't belong, I remember when we were at church one Mother's Day when I stopped going to church on Mother's Day. They asked all the mothers to stand, and here I was sitting. I had just gone for artificial insemination that did not succeed a few weeks before that. And I felt so alone. I felt like because I felt like everybody was looking at me. Everybody could see my struggle. I'm that woman that, oh no, she's cursed somehow because agatola bantwana. So it really does become difficult at some point.
Yeah, I mean, you are now reflecting on the whole journey when how we respond, right? And I'm glad that you brought that up because in my work I've come across, when it comes to an issue like this, there are many people involved, right? There's the couple, and then the lady and the man, and then there's like the extended family, and then the community. And it seems as if everybody has a say about what should happen in the way that you describe, that in certain spaces, communities, everybody's expecting, they're asking you, when's the baby coming? And I thought maybe to share a little bit about that, or maybe to expand the idea. You touched on how other people are responding, typically blaming the woman, but men also struggle with the issue. And the other issue I bring up is the lack of information, right? To explain what is going on, or we take it for granted that, of course, we are a couple, of course, we'll have a baby, and it's not as simple as that, So maybe just a comment on the different people who are involved now in commenting or responding to the couple that's not having the child. What have you observed? What does the family typically do? What do men typically do? And what do women typically do?
All right, great question. Thank you for that. So let's start it from when the couple gets married.
Yeah.
Kasisotho umakoti uzonikezwa igama, so utlofuwa lebitso ngwetsi e ntšha high go tla thwe ke Mamorena, ke Mathapelo,
so they
whatever
give you a name.
Yeah. Yes, the name already. The family has an expectation because then your firstborn son will be named Thapelo Morena, and so on. So from the onset, when lobola is being negotiated, batenga the right for your daughter to bear children for us, basically. African,
to increase the family, to build a name and a legacy.
Exactly. That is why ufuwa libitso. I think as a Zulu, they call you by your surname, and then later on they call you by your child's name. And I'm gonna come back to share a short story on that. So it's the family, the immediate in-laws that now have the right to ask, when are you having? Yeah. And then you've got the church community that marries you. Maybe they've seen you as young people, you were growing up in their church, and now you got engaged. So everybody's involved in the evolution of your relationship, So in a year or two, we are expecting to see little Zwanes running around. That's the norm. That's how things are supposed to.
Yeah.
Exactly. There's the expectation. At some point, nibe nesmoto, and then so that is the expectation, the beautiful, perfect picture that people have about us. As well, people that we usually don't take into cognizance when we think about the community of people that comment on our fertility challenges are our colleagues, people that we spend We spend a lot of time with our colleagues.
Yeah.
And guess what? The cafeteria or wherever people meet in the office, what is the primary discussion now in January? Oh, my child is going, oh, she's doing grade one. Oh, look, she is. Oh, yeah, there's my child, this, my child, that. And immediately the person who is infertile or going through fertility treatments and those that have lost children, already they are excluded out of the conversation.
Yeah.
So those are people that would comment. Now, the strangest one is the strangers, just common strangers, people that you don't know. Hi,
Kunja.
You know, oh, okay, what do you do for a living? Oh, okay, so it's part of the conversation of getting to know one another. That I think with time, as an organization, we are teaching that some questions are sensitive. Don't include them in the conversation unless the person says, I'm married with 2 kids, you know. And I just want to go back to Indaba Yamagama. My son, at some point, so we went to KZN, my husband and I, and during a funeral. So Angite Kaya, it's very difficult to be Zumuntu love, baby. Life
yeah,
fine.
You must respect the situation.
So you must respect the clan. So usually when we are among people that are not Zwanis, I would call him Zwani Mangeti. But now Sika Zwan, everybody is Zwani Mangeti. So I can't say that. And we don't have a child. So we are sitting in a rondavel, it's a funeral, it's Lili Matrasi in Ilapo. And then I say to one of the cousins, Ncela uncelele ubhuti uthi angifakele isikhwama lesi ebhutini. And then uyasithatha uyaphuma. And then one of the aunties says, wathi wambiza ngobhuti niyalamana yini? I'm like, okay.
Calling you brother, are you siblings? Yeah.
Yeah. Are you siblings? And I said, no. Okay, ngizombiza ngokuthi ubaba ka firstborn yakhe umfana ubaba kaSibanibani athi awukwazi ukusebenzisa lelo gama ngoba lo yakusumntanakho phela akuzalelwana so I was not allowed to even use my stepson's name when I'm my husband. So already as a woman, I feel, and at that moment, out of respect, you can't backchat. You can't so much just hold it back to the person who's commenting.
Be respectful.
Yeah. Yes. We try to be respectful. Right. Yeah.
Yeah, and you know what you're saying, we take it so for granted, but I bet the weight then on a person, you know, here you are trying to be decent and you're asking a simple thing, but it gets so complicated. And I think that's where we struggle as a community, as people, to imagine what people are going through. You know, you touched on it. I wanted to ask you the sort of things that people, we need to be mindful of. When we talk to people generally, you know, when are you having a baby? Are you pregnant? You know, what are some of the things that are taken for granted that might be offensive to somebody going through that challenging journey?
Well, the first one is the obvious one. When are you having children? I think we should allow couples to be. I think we should allow couples the space to choose whether they would like to have children or not. And we should understand that that is none of our business. We should allow people to make choices, whether they're infertile or not. I think we need to start it there, that their family planning is not my business unless they choose to include me in it. Because there's couples that will choose not to have children at all, not because they've got fertility challenges. And we should respect that. Those are people's choices. As well, when someone is pregnant, don't go on to say, hey, congratulations, you are pregnant, because there's women that are having health challenges that are making their babies look as though they are pregnant. So it might be offensive. So wait for someone to give you a hint or tell you that they are pregnant, you know. In our African culture, we are advised as women not to tell people about our pregnancies, because then people are afraid of being bewitched and so on. Another one is touching the belly. And these are all relative culturally. In KZN, in Venda, it will be different. Here in Gauteng, Joburg, you know, we greet each other, we touch, we kiss, and according to one's belief, I think let's respect where people's boundaries are. The next one, which is difficult, is when someone has been pregnant, you know that this person was pregnant, but they lost their child. So they had a miscarriage or they had a stillborn. How then do you tackle this? What do you say the first time when you see this person? Are you going to say, it's going to be okay, you are going to have another child? No, you are gaslighting the pain that this person is going through. So just assure the person, especially in the work environment. And I say this because usually when a woman goes for maternity leave, they get 4 months maternity leave. But once there's a stillborn, then it's only 6 weeks of the procedure, medical procedure that was done. So after 6 weeks, the woman would go back to work, but I don't think emotionally they are ready to function at a level where they are expected to function optimally at work. So as colleagues, it's important to create a welcoming environment for this person. Acknowledge that she is an angel mom. Acknowledge that. You might not say that I understand what you're going through, but the most important thing, if you need anything, please let me know. Check on them. So and so, did you have lunch today? Can I make you a cup of coffee? So offer your services more than talking to the person. And as and when they are ready to talk, then they will talk. So that is my advice regarding how to handle situations that are uncomfortable. Yeah.
No, thank you very much, because I think it's insightful, you know, and a lot of us take things for granted, right? And you touched on, say, how when somebody comes back, and we must be mindful of how we address them if they've had a miscarriage or they had a loss. Now, the maybe two more questions from me, but the first would have to do with the couple itself. So I'd asked, you know, how the different people respond, but I've also observed that men and women, the couple themselves, sometimes, I don't know if it's your observation as well, there's a lot of blaming, a lot of shame, a lot of accusations, a lot of, if a man goes somewhere, gets advice from the wrong people, no, you need another person, no, you are bewitched, you know, but women then would often talk about what they're experiencing. And then I've heard many women say, but my partner just came back and it's almost as if he changed. So I wonder about where men go to talk about it. Who do they talk to? What do they hear? So just the way, you know, the couples typically respond, you know, some leave, some, in fact, the loss of a child, I think, is one of the leading causes of divorce. And so just the different ways that couples respond, then I'll ask you one more question about the organization.
Yeah. Um, Couples respond differently. You are right. Males respond differently than females. First of all, we need to acknowledge that the female, even though she's the one that carried the baby and has to go for the procedure of removing the fetus, does not necessarily mean that they are the ones that are hurting the most emotionally. So we find that the support system, the community around the couple often focuses on the woman because the woman was the one in hospital, probably the one that had a C-section or a DNC, and now everybody focuses on the woman. But they forget that men as well go through the most. I think men go through a lot. And the fact that we are not seeing the pain, for me, is worrisome. And remember, males don't generally go to seek help. They want to be heroes of their own lives at first. So they for basic things like going to check for prostate cancer, stats show you that more women go for pap smears than men going for check for prostate cancer at a certain age. So this tells that men are reserved. They want to be their own heroes. It's difficult for them to be vulnerable to people unless bahleli namajida and they are drinking, and at some point the mind will start opening up what on the inside, and this is where you start seeing guys crying. But at that moment, amajida, they are not equipped enough to help this person, bazomlalela. But because probably they are under the influence, tomorrow bazobe khohliwe, or they will just remember that this person, this is what they were talking about, but they will not go back to it to say, in fact, I think you need to go for counseling. I think you need help. Another one is the couple themselves, the two people that live in the same house that have a relationship. There's many ways we can look at this, but you are right that sometimes there's blame that comes in, especially when there is tension between families. You might blame the family. That is because that is why I had a miscarriage, your sister bewitched me, or whatever. So where there's tension, you will find that the problem usually goes there. Another one is if the man or both the couple did not agree on the fertility processes that are going to take place. For example, maybe the man didn't want to go for IVF, and he feels forced to go and do it. And now here's this woman that had an unsuccessful IVF, and she's crying, going through loss, because it didn't work out. And the guy might be like, please don't bother me. I told you that we shouldn't go for this. Now you are crying. You're not my burden to carry, so I'm not going to be part of this. And you see avoidance then happening and the couple drifting apart. So it's important for couples to support one another. It's important for them to talk through it. It's important for them to go for therapy and talk to someone that can help them go through their grief, their loss. And also the pastoral community, the religious community, I think we undermine the power of the church and what pastors can do. Pastors are leaders that have immediate access to the couple when they receive the news that they have had a loss. So I think it's important that pastors should be trained and be alert when these things happen, to refer people to the right specialists, the right professionals that will be able to help the couple.
So, I like what you're saying about the power of the church and the community, just the insights you are giving us. And speaking of then about, because it's one organization that you're talking about, but you guys have one, right? And so when did you start it, and what do you typically focus on, and what has been, the highlights of what are you seeing? Because now we started the story from your own struggle. You work through it, you get to a point where you're helping other people. Some of the highlights, and what are you guys doing, and what does the future look like?
Mm-hmm. Well, we started HANA in 2018, August 2018. It was launched on the 20th of August 2018. And our aim is that we assist couples that are going through infertility, both emotionally, spiritually, and referring them to the right doctors that they should be going to. So as a couple, we've teamed up together. So my husband talks a lot about his journey with male infertility. And he expresses his emotions about what he was going through. So which is something that we honestly don't have out there, where men are saying, I've had a struggle with male infertility, and here I am. This is how we were able to conceive our child. I also share a bit of my story, because I was diagnosed with an autoimmune disease that was the cause of the recurring early miscarriages that I was having. So had it not been for a fertility specialist that went on to investigate what my problem was, I wouldn't have known. And it's something that is treatable. So I was able to be put on medication, and few months later, I conceived my son. So information is key. So we have breakfast symposiums that we've held in the past, where we invite fertility specialists and psychologists to come and help couples that are going through infertility. So it's basically a free consultation, a very informative session, and the psychologist will usually take the couples through the emotional journey that they will go through when they are going through assisted reproductive technology. There's a lot of options out there. There's also state organizations that fertility clinics that are offering services to people who cannot conceive, and also, but they are unable to pay for, the full 100,000 rands, because for you to do IVF in South Africa, you basically need between 100 and 180,000 rands per cycle. So that is just one chance, trying one chance to fall pregnant. So we bring education, we bring attorneys to talk about processes of adoption and processes of donor eggs and sperm donors. How does all of that go? Advise LGBTQI community couples on how to go about getting donors. And we are a faith-based organization, so we believe that God does miracles. We do not exclude anyone because of their sexual orientation. And we also work with the Fertility Show Africa, we are speakers at the Fertility Show Africa, just sharing our story and sharing the story with the rest of South Africa whenever we get a chance.
Wonderful, wonderful work. I mean, when listening to you, responding to this particular question, I mean, you talk about the amount of work that you do from the experts, the groups you're working with, the knowledge you are bringing, opening yourself up. And I think it's just beautiful work for something that, a lot of people feel shame and, they feel hopeless. And I'm glad that you are doing this kind of work. And thank you for the opportunity to interview you, to have this discussion with you. Sounds like with time we should have more and go into detail, regarding the different facets of what you're doing. But otherwise, thank you very much.
Thank you so much for having me.